Hello everyone, thank you for joining us today on the program Healthy Living. Here I am, armed with my little red diary with other questions I need to ask the doctors today. So stay tuned and enjoy everything that we have for you. It is imperative for you to sit down and watch this program because without the heart, there is no human. So we're talking about the heart today, more so that Friday, September 29 is World Heart Day. It is set aside to look at the heart again and to create awareness for you and I to know how to use our hearts, because a lot of us don't know how to. So today we're going to be looking at the heart, what kind of diseases that can happen to the heart, what are the signs, what are the symptoms, what treatment avails you, at what point do you go for a surgery? All of this and more we're going to be looking at today on the program Healthy Living. I'm Adesu Walsawage, and I'm being joined today by two gentlemen. They are doctors from the University of Benin Teaching Hospital here in Edo State. I have with me, directly beside me, is Dr. Ojo Akinwumi. He's a senior registrar cardiology from University of Benin Teaching Hospital. Dr. Ojo, happy to have you join us today.
Thank you very much, Adesu. Nice to be here. Good afternoon, everyone.
Okay, seated beside him is Dr. Egbodion Usagi. He's also a senior registrar cardiology from University of Benin Teaching Hospital. Nice to have you doctors here today. All right, doctors, in no particular order, we're going to be looking at the heart. Okay, the heart is very important. And from research, I discovered that about 17 million people or thereabout die every year from heart-related disease. That's quite huge. That's huge. So let's start. What is the heart? Let me talk to you, Dr. Sagin.
All right. The heart is a very vital organ of the body, one of the most important organs of the body. It has several functions, one of which is to pump blood to all parts of the body, gives nutrients, oxygen to every cell in the body. So it's the mitochondria of the body. Without the heart, we can do nothing.
Absolutely.
So the heart is that structure that makes us to live. Heart is that structure that makes us to do our daily activities without any form of hindrances. Okay. So it's very vital, and above every other organs, the heart plays a key role in maintaining the normal homeostasis, that's the balance of the body, in terms of blood supply, in terms of oxygen and nutrients to every part of the body.
Okay, that's fantastic. Okay, Dr. Akinwumi, what are the problems that can happen to the heart? What kind of diseases that can happen to the heart?
Thank you very much for this. As we said, the heart itself is a structure, has different layers, from the outer covering to the muscles, then to the internal covering. And inside this internal covering are the valves. So talking about the different disease conditions that can affect the heart, it's actually take each of these different layers. From the outer covering, we can have problem with the covering, what we call the pericardial diseases. Then from the muscle itself, we can have problem there. When we talked about cardiomyopathies, can affect the heart. Then from the internal covering itself, the valves are there. You can have different types of valvular problems that can affect the heart. And we have some other problems that are not particularly located to the heart. Majorly the vessels that supply the heart. That is the coronary artery disease, that we call the heart attack. Because when the heart itself, as my colleague said, pump blood to every part of the body. But the heart itself also pump blood to itself, it supplies itself. So when the pipe that carries blood to supply the heart itself is blocked, that will call the heart attack. And that's another very common disease condition that you can have around that affect the heart.
That's huge. Now let's look at heart failure, heart attack. Are they one and the same, Dr. Sagir?
All right, thank you.
Somebody say, the person get heart attack. Or they say, the person get heart failure, that kind of a thing. Are they one and the same?
All right, these are common things that are usually used by laymen to describe heart attack. So we say cardiac arrest, heart failure, and all that. But in the real term of medical term, when you say heart attack means cardiac arrest. That is, the blood supply to the heart itself is compromised as a result of blockage or rupture of the vessels to the heart. So that's what we call heart attack or cardiac arrest, or what we commonly call myocardial infarction, blockage, complete blockage of the vessels that supply the heart. But when we say heart failure, it's a constellation of signs and symptoms, meaning that the heart can no longer do the work which it is meant to do. Like we said, the heart is supposed to supply blood, oxygen, nutrients, but all other vital organs of the body. But when the heart starts failing, inability to do that, you see somebody having leg swelling, walk from here to the gate, he or she gets tired, and the person is now coughing thick sputum, and the person can no longer lie down flat. We think those constellation of symptoms as heart failure. That is, the heart can no longer do that work which it is originally made to do.
So when the heart cannot really do what it's supposed to do, what next? What can be done to that heart?
Right. First, we need to know what has actually caused the heart to fail.
Okay.
The commonest we have is hypertension. That is what we commonly call the high blood pressure. Other things could cause the heart to fail. Diabetes mellitus, smoking, excessive alcohol, it can be genetic. Some persons are born, they have problem with their muscles. They also call cardiomyopathies. So the heart can fail for various causes. But answering your question, what could be done when the heart has failed? It could be medical. It could be surgical. Medical, there are treatments that can be given to the heart. Heart has failed, we will give drugs. There are drugs that will help. Because one of the things that happen when the heart fails is that there is accumulation of fluid in the body. So one of the drugs we give is to ensure that the fluids in the body are released. So when they are released, the heart itself is relieved. So that is one. So another thing we can do is to treat the immediate cause. What is the cause of the heart failure? So if the patient is hypertensive, you have to treat the hypertension, ensure that the blood pressure is controlled. If the person is diabetic, you want to make sure that the sugar level is also controlled. If the patient has family history of similar issue, you want to screen and examine every other member of that family to be sure that they are all safe. If the patient is alcoholic, you want to ensure the patient stop alcohol, the person smokes. So you have to address each of them. Of course, if this medical treatment fails or there is no remedy to this, you have to do a surgical intervention. There are different forms of surgeries.
Okay, before we go into all of that, let's look at signs and symptoms. I'm supposed to ask you that first, but you know, with what we're discussing, I had to ask you all of those questions on signs and symptoms, because for someone to have sudden heart attack or sudden problem to the heart, there must be signs and symptoms, though a lot of us tend to ignore all of these signs and symptoms. So, Dr. Joe, signs and symptoms.
All right, thank you very much. The signs and symptoms of heart disease is actually variable. Start from the common things that doesn't give any sign at all, like hypertension. As we have said earlier, hypertension is a major risk factor for heart disease in our contemporary time. In Africa, we know that the incidence of hypertension is actually rising. And we have to say that most of the time, as I said, hypertension is a silent killer. It doesn't give any sign. In fact, if you wait for sign for hypertension, it must have gotten complicated before the sign comes. So from common ones like palpitation, some people say they are aware of their heartbeat. Normally, as we see them, our heart is beating. We're not supposed to be aware. Normally, the heart is just there doing its work quietly.
We're not supposed to be aware.
Yeah, but by the time you are not running, you are not afraid. Not that you just maybe saw a snake or something, but you have continuously be aware of your heartbeat. Sometimes the heartbeat is irregular. So those are the one of the signs of heart disease. It shows that there's something there happening, and those kind of people should come to the hospital for a checkup. Then also chest pain is very common. Chest pain sometimes is vague. Sometimes people say it's ulcer. Some people have taken different type of anti-ulcer medications for this chest pain, and the chest pain is not there. For those kind of people that are hypertensive, they are diabetic, they are smoking, they are taking alcohol, and they have a chest pain that is not going with the use of anti-ulcer drugs, that could be a sign of heart disease. And those kind of people should come to the hospital for a checkup, because if you don't check, there's no way you will discover that those kind of things are there. Then to some other things like increase effort intolerance. Someone can walk from here to the gate before, but now we cannot just walk from here to the sitting room. Somebody can, go to the farm before, but now he cannot even you know, do anything in the house. So those are one of the signs that, hey, there's something wrong with the heart. Breathing fast, leg swelling, sometimes effort intolerant. Some people even just collapse sometimes. That could be a sign that something is wrong with the heart. Those kind of people, when you notice those kind of things, you should rush to your doctor for a medical check.
Okay, now let's look at children, because each time we run a program like this, I'm very concerned about the children. Now let's talk about children. How do you recognize that a child is having a heart problem, particularly the ones that they will say have holes in the heart and all of that? So how do you identify? Let me talk to you now, Dr. Sandro.
All right, thank you very much. Like we said, you know, commonly when you say heart failure, people think that heart failure affects elderly people, adults. It can occur in children. We've seen a number of cases where heart failure occurs in children. And most times when it occurs in children, we call that congenital heart diseases.
Congenital heart diseases.
That is what people commonly call there is hole in the heart.
How do you know? Most parents don't know.
They don't know. It's true. Most often the time, the developmental milestone is delayed, or there's a slow developmental milestone in those children. You see a child who ordinarily want at age 0, month 0, 6, 1, there's a stage. There are stages that the child ought to go, but this time the child cannot do that, cannot play with his mate or her mate. You see a child getting breathless, just feeding the child alone. You see the baby or the child will get breathless, cannot catch his or her breath. That is one of the signs. Coloration of the eyes, cyanosis, what we call cyanosis, central cyanosis. Patient will have it because the patient has congenital heart disease. Patient, of course, stunted growth. The patient will not, when you look at the growth percentile, you see the patient is slow for that. So this constellation of symptoms and other signs will show that this patient might have congenital heart disease. Evidently, you have to do an investigation to say yes, of the truth, this patient has congenital heart disease. Meanwhile, there are all different types of.
We live in a country where people have bad attitude towards medical care. Yes. You know, rather than go to the hospital, you first look for one or one home remedy, or we want to pharmacy, or we go to somebody who has similar problem. What do you is that the kind of culture that we have? And most parents, from what I've read, from the little research I did, most parents present when it's almost late, or when they go to hospital for something different, and then it will just be discovered that, oh, this child has a hole in the heart. What is that particular thing a parent should look at? The parent to say, no, you got to go to the hospital right away.
All right, thank you very much. I like the first statement. You see, the truth of the matter is we have to cultivate the culture of healthcare. We need to first, every one of us. But
that's because of the high cost of assessing medical
as part
services.
of our recommendations today is what I think that's part of what we're going to discuss today, subsidizing healthcare for our people. Because the truth of the matter is that if you don't have high index of suspicion for such, you wouldn't know. You've seen a patient, somebody, you give birth to a first child at the age of 6 months, 1 year, the patient, the child dies. You give birth to another, die, and you are not worried. So most times, this might just be congenital.
One person in the village and all of that.
That's part of the issue we have. Because apart from there are a lot of myths about this issue of heart diseases. So people will feel, oh, it's one person in the village and the other. The truth of the matter is that when you see your child not doing well, as you know, you are a mother, you know your child is not growing the way he or she should grow. It's not feeding well, or just getting lean by the day, getting breathless just by feeding him or her. You should be worried that this is not normal. It's a sign that there's a problem with the heart. Because the heart is supposed to control the activities of the body, but the heart is overworked by just small exercise, and as such, because the heart is failing or has failed. So that's alone should prompt a parent to go to the hospital to seek medical care or advice. You never can tell. Because the truth of the matter is that when you come late, most often the time, there's really nothing that can be done. So I think above all, we should cultivate the habits and culture of going to hospital when we have issue.
Okay.
Small or large.
So I'm hoping that you that have this bad attitude of going to the hospital, you will learn today that it is very important for you to seek medical help. Doing self-made, particularly when it has to do with the heart. In fact, any aspect of medicine is wrong. Let me continue. We've talked about quite a number of things, like what trigger. And then you see people mixing, you have a cocktail of different kinds of it doesn't have any impact in your heart.
Yeah, thank you very much. Yes, we know that most of these drinks, especially those ones that contain a lot of ingredients, some of those ingredients are stimulants. And those stimulants, they call them energy drinks. Sometimes increase blood pressure. And we have to note that. Also very important, it's smoking. A lot of people are still smoking. And we have to say that smoking is dangerous to the blood vessels. And what it does is to accelerate the clogging and the occlusion of the blood vessels. And that can cause heart attack. So alcohol is also very important. And initially, people talked about take small alcohol, it's good for the heart. But the recent findings have shown that we should actually abstain completely from alcohol.
Very small is never good.
No very small again. No very small again. What we are saying now, what we are advocating now, by the newest guideline, is that we should abstain completely, especially for those people that have either history of heart disease, or they have parents or family that have heart disease, or people that are hypertensive, people that maybe their doctor have told them their heart is enlarged already, people that have had MI before. So those set of people should actually completely stop taking alcohol. Another thing I want to talk about is our salt intake. Our salt intake is also very important. People have the habit of putting an extra salt on their food, even when their wife are finished preparing food. So the more the salt, the more the blood pressure. The more the salt, the more the heart will not be treated. Some people are taking drugs, just the that you are taking drugs, your legs are still swollen, and you are taking drugs, your doctor is just wondering what is happening. Maybe that little extra salt that you are taking in your food. That is yes.
So, okay, we've heard of stories where people die after using aphrodisiacs. Is it?
Yes. Well, aphrodisiacs are these are stimulants just to boost libido or whatever.
We heard of sudden that the person will just.
Yes, it's common these days, especially among youth and some other adults. For one reason best known to them, they want to take it. It's actually a bad habit, because the truth of the matter is that one of the things it does is stimulates the heart so much. The heart is supposed to contract at a very stable rate, 60, 100. By the time the heart starts beating too fast, above 100 beats per minute, then there is a problem. So the heart will start accelerating and beating too faster than it can. So that can make the heart to even fail itself. There's what we call atrial fibrillation, where the heart will skip because for one reason or the other, the heart is stimulating and contracting irregularly. So these are things that I think we should avoid. Especially among young youth, they are taking a lot of stimulants these days, whether to boost their ego or whatever. I think these are...
It's a youth thing now. Even some older men are taking them.
Yeah, because the truth of the matter is that now, heart failure is very common with elderly. Old age is a risk factor. But these days, you see young men and women coming with heart failure. What could be the cause? Some are not even hypertensive, they are not diabetic. So if you do a lot of studies, you discover that some of them are into these stimulants. And I think they should desist from it.
The way you're saying it now, are you sure somebody who is using it will desist from it? Because it's like, regardless of the huge awareness campaign everywhere, people are still indulged in all of these things. Because you hear them say, I beg, you don't tell we will drown. You know, are people the same? Do people react same to such drugs.
That's what I keep telling them. It's just like the issue of alcohol. Oh, somebody proud to know they will tell you that for male you can take 21 units in a week. It's okay, but no more than for female you can take. But the truth is that people react differently to different things, even to alcohol. Somebody can just take a glass of alcohol and can turn to something else. So that's why the latest kind will tell you, if it's possible, you avoid it. That's the truth.
So apart from alcohol, salt, enhancer, stimulants, are there other things we should run away from to prevent?
Another thing again I know is common, although it's difficult for our parents, those who cook with firewood, this smoke, yes, it can cause heart failure.
Okay.
Yes, over time it causes respiratory failure, and over time again it can lead to heart failure. That's cooking with this burning a wound and all that. So I think these are things that we should also know and see how we can reduce, if not totally stop them.
Okay, Dr. Joe, our time is running out. Let's look at chest pain, heart failure. You know, some persons will complain of chest pain, heart failure. Is there a relationship?
Yes, for chest pain majorly talking about the heart, it's due to heart, the blood vessels that supplies the heart, I mentioned at that time, when it's blocked, when it's suddenly blocked, or it bursts or something happened to that vessel, the area of the heart that is supplied by that particular blood vessel will not get blood. As you have said initially, that the heart is responsible for taking blood to every part of the body and also supply itself. So if the blood vessel is blocked, for example, so that area of the heart will not get blood. So that area of the heart, because it doesn't get blood, will start dying. So in that process of dying, release some chemicals, and that chemical can cause pain. So chest pain, when it's severe, can actually be one of the manifestations of what we call heart attack, what we call myocardial infarction. And if that one is much, if the area of the heart that is involved is so large enough, it can actually cause heart failure. And heart failure means that the heart is not able to perform the function that has been created by God to perform.
So in such a situation, what is the option open to this person?
So in such a situation, it is a very, very important one, because in our country, managing those kind of situations is actually very costly. And that's why when we have a meeting like this, we talked about prevention. Prevention actually saves a lot, because managing them means that you have to give them some drugs that will open up those vessels. Those drugs are not cheap, they are very expensive. Sometimes the drugs you give them will not even work. You have to take them to theater to go and perform what we call catheterization and do some procedure to open up those vessels. Those procedures are not really available in many states. Maybe there are just a few centers in the country. So managing this kind of situation is very expensive, it's not cost effective, it's not really available, it's something that it's not even like a 50-50 kind of a thing. So it's actually better to actually prevent such things from happening and to start.
So in the next minute, Doctor, in the next 1 minute, shall we quickly talk about prevention, because we have just about a minute, 20 seconds there about.
Yes, talking about prevention, one is that we have to take care of our heart. The theme for the World Heart Day for this year is that use heart, no heart. And the meaning is that we should take all our efforts to take care of our heart. Those silent, small messages from our heart should not be ignored. By the time you notice those messages, don't just say that at home. Don't just say it's just one of those things. Just say it will soon go away. Come to the hospital.
Don't wish it away.
And come to the hospital, let the doctor check you up. And treating at that very early stage can be life-saving, and so that you can avoid a major disaster later. Okay,
people have this myth about doctors in UPTH that it's difficult to assess them. Dr. Sagi, how easy is it to assess doctors from UPTH?
Well, that's a common complaint. Even today in the hospital, in the clinic, a patient said it's difficult to assess doctor. Well, the burden is much, I must say. We understand the fact that we have fewer doctors in Nigeria. The doctor-to-patient ratio is quite
the Japa syndrome.
Yes, yes, that's the truth. But I still believe that if you need the attention of the doctor, no matter the time it costs you, you have to. Sometimes you go to a bank for your money, you stay in a queue for God knows when. But I think the hospital is also compartmentalized, that we have a section for emergency. So if the case you came with is an emergency situation, there's an emergency ward that you have emergency doctors that will take care of that.
All right, gentlemen, it's been nice talking with you people these few minutes, and I want to extract a promise from you now that when we call you, you will answer me ASAP, you know?
No problem.
Okay, so thank you so much for finding time to join me today. All right, so as they said, use your heart and know your heart. If you have this cliche at the back of your mind, you will avoid all avoidables so that you will be healthy. Management and treatment is quite expensive. I didn't say that, it came from the doctor. So prevention is quite cheap and easy and accessible. So if you employ preventive measures, you'll be happier. Thank you, gentlemen.
Thank you very much.
All right, we'll see you again on Monday. Bye-bye.